This video lecture will briefly overview diseases and disorders of the male reproductive system, as well as alterations in sexual function, as well as the most common sexually transmitted diseases. In the male reproductive system, from Bio 202, you know that the system focuses on quantity. Massively produced gametes, release them quickly. Doesn't leave a lot of vascular and glandular tissue to be affected by diseases, so there's actually relatively very few diseases in the male system compared to the female. The branch of medicine urology that deals with the lower urinary tract actually pulls double duty dealing with the male reproductive system because they share urethra. You're going to be studying the signs and symptoms of male diseases and diagnostic tests. Now, when we look at the male system, you'll review through some of the basic structures like the ovaries down in the scrotum, the vas deferens come up behind, the prostate gland, the urethra, the penis, and those structures. Diagnostic procedures are pretty straightforward. Now, when you take a look at the diseases of the male reproductive system, you're going to be looking primarily at diseases of the prostate gland, the testes and epididymis, and then some accessory structures. The prostate, as you remember, surrounds the urethra. It produces chemicals that contribute to semen, and you're going to review the three most common problems, and one is the benign prostatic hyperplasia, called an enlarged prostate. You're going to learn about prostatitis, inflammation of the prostate, most commonly due to infection, and prostate cancer. Now, the two most common diagnostic tests that we perform are the PSA blood test. PSA stands for prostate-specific antigen. And this tells us that prostate cells are growing and dying faster than normal. DRE is digital rectal exam. That's where the finger is pushed up through the butt and you palpate the prostate, looking to see if it's large and or tender. Based upon the results of the PSA and DRE, you can generally get a pretty good diagnosis of what's wrong with the prostate. We move on to the testes and epididymis. We're looking at the testes hanging down in the scrotal sac, and you're going to find various problems like orchitis, or varicocele, or hydrocele, or even testicular cancer. And you're going to be describing what has caused each one of these and how it impacts the male reproductive system. The accessory structures involve basically the penis and actually male breast tissue. And so you'll describe different problems that can occur to the male penis, and you'll talk about enlarged breast tissue called gynecomastia and how that can correlate with male breast cancer. Now that's the rapid, quick, and dirty on the male reproductive system. We move on to alterations of sexual function, and the four most common problems that you find will be impotence, dyspareunia, arousal orgasmic dysfunction, and premature ejaculation. Study through each one of these, understand what the cause is, what the result is, what organs are affected. Pay attention to if this is a physical problem, a psychological problem, a hormonal problem, maybe a metabolic problem, such as medicinal drug reaction. Understand age-related changes to the reproductive systems. Climacteric is the end of reproductive life. In the female, that's referred to as menopause, and in the male, that's referred to as andropause. Be able to understand the events occurring there. We finally talk about sexually transmitted diseases. We're going to pick the most common ones. Now, look at your outline. That'll tell you which ones you need to study. You're going to group them into three big groups: viruses, bacteria, and eukaryotes. And that's going to be your most important priority, is knowing which falls into which category. So we look at things like AIDS, genital herpes, genital warts, mononucleosis, hepatitis. Know that these are caused by viruses. Know the most significant presentation of each one of these. What structures are affected? Bacterial, you're looking at chlamydia, gonorrhea, and syphilis. And again, know what pathogen affects it and what the most common signs and symptoms are. So as an example, when you take a look at syphilis, you are going to take the time to learn what primary syphilis, secondary syphilis, and tertiary syphilis look like. There's even a limerick found in the PowerPoint on Canvas that gives you a nice progression of the three stages of syphilis. Finally, eukaryotic sexually transmitted diseases fall into the protozoan category of trichomoniasis and the fungal category of candidiasis. You'll be able to tell me what are the most common pathogens that cause those. That's the quick and dirty of it. And so take your time looking through your notes, use the outline to help you figure out how much detail and which diseases to study. Send me emails if you have questions. Good luck.